Throughout this video, you're going to hear me use a lot of big fancy medical terms to describe the minimally invasive procedures we perform here at Sarasota Interventional Radiology. If you have any questions, either go to our website or call our office. We'll be more than happy to explain to you exactly what we mean and exactly what we're going to do for you. Back pain can be due to several different mechanisms. Quite frequently, especially in older females, minimal trauma or even no trauma can result in fractures of their lumbar, thoracic, or cervical vertebral bodies. Those are called compression fractures, which are extremely debilitating and painful. Typically, in years gone by, these were treated with conservative medical therapy, pain medications, and patients were told to limit their physical activities, basically stay in bed for several weeks until the pain subsided, and eventually the fractures would heal. But it was a miserable several weeks experience. We now have the ability to essentially cast these fractures from the inside out using a procedure called vertebroplasty or kyphoplasty, where basically we introduce a needle through the skin into the vertebral body and basically inject a cement that essentially casts the fracture from the inside out. So it seals all the fracture lines, restores the vertebral body height, and immediately alleviates the pain. So if you fractured your back yesterday, we do the procedure today, tomorrow you feel 100% better. When we do these procedures, our nurses always do next day follow-up phone calls, and universally patients feel 100% better the next day. They can't believe how much better they feel, because typically these patients have been treated conservatively several times for weeks and sometimes even months, and just have chronic debilitating pain in their back, because every time they move their body, these fracture lines in the vertebral bodies essentially shift, so it's just agonizing pain. You cast the fracture from the inside out, they feel immediately better the following day. Our philosophy here at Sarasota Interventional Radiology is, if you fractured your back yesterday, seek our help and attention today. We'll see you today, we'll do the procedure tomorrow, and by day after tomorrow, you're going to feel 100% better.